And welcome to the Dr. Steve Show. We've got a lot of great information for you today. We're going to talk about osteoporosis and why it affects pretty much everyone.
And we're also going to talk about falls and the risk of falls and what we can do to prevent them.
And you're probably wondering why we're standing outside in front of this van. We have got a surprise for you. We're going to take the Dr. Steve Show on the road.
We're going to go on the road. We're going down to Shady Side. We're going to interview a surgeon regarding ACL reconstruction.
And we're going to have a little fun with Dr. Steve while we're down there.
That's right. I got some skin in this game.
Ready to go?
Ready to go.
Let's go. And I'm hearing that you kind of know an ACL injury pretty up close and personal.
I do. I had the same injury. I tore my ACL and I had to have it reconstructed surgically.
Where do you go with a sprain, a twist, or a tear when your body needs repair? Call Allegheny Chesapeake Physical Therapy. For many problems, the best treatment isn't pills or surgery, it's physical therapy from Allegheny Chesapeake. Therapy is often the best choice for the fullest recovery. Physical therapy works. Research proves it. When your body needs repair, call Allegheny Chesapeake Physical Therapy, 1-800-NEW-SELF.
There's no place like home. There's no place like home.
Walnut Medical is the area's #1 home medical equipment provider, devoted to getting you home as soon as possible. Walnut Medical has 7 convenient locations and services 18 counties in central and western Pennsylvania. Walnut Medical specializes in hospital equipment and medical supplies. Walnut Medical has 2 convenient Johnstown locations, Main Street downtown and Franklin Street next to Martellus. Remember Walnut Medical, because there's no place like home.
Our PCP had seen that I had an arm problem and recommended that I go to Allegheny Chesapeake and see Dr. Jessica.
And for me, the same thing, PCP had me on cholesterol medications that I didn't want to take because they kept tightening up the muscles in my back. So he sent me up here to Allegheny Chesapeake and they taught me how to do stretching exercises, which has completely eliminated all my back pains. It's awesome. I've lived with back pain as a diesel mechanic and aches and pains, you know, bending, stretching, forever. I mean, regular chiropractor adjustments, everything. Just learning how to stretch in the right ways, it makes a major difference.
We're pretty active. Like I said, we scuba dive, he does a lot of hunting, and the active lifestyle that we have, we're in our mid-50s, we want to keep that active lifestyle. So we're looking for any help we can get to maintain that into our 60s. And one thing I liked about Jess is she believes in working with your orthopedic doctor, with your PCP, with the chiropractor. It's the whole picture for her, not just I'm your therapist and this is it. Don't bother going anywhere else. She works with everybody, and I think that helps bring in all the different strands of help that you can get.
And actually, you know, I just seen the surgeon for my shoulder, and the one thing I wanted was what Jess had to say. She works on my body at least twice a week. She knows what my body's doing. That doctor's seeing me for 15 minutes in his office and making decisions. Her opinions to me are very valuable. Valuable enough that I hand carried the letter written by Allegheny Chesapeake to the doctor. So here it is. I want you to read what they had to say.
And welcome back to the Dr. Steve Show. We're going to talk about osteoporosis, but wait 1 second. Good stuff. Listen.
It is good stuff, but for osteoporosis, it's not enough, especially at your age.
But I drink lots of milk. Did you say something about my age?
I did. And the reason I said that is because it's good to drink milk. It's good to pull in a lot of the calcium and stuff when you're younger, before you hit that 20 and 30 range, because at that point, osteoporosis, what happens is bone is normally being built and broken down at the same time. When you're younger, you're building more than you're breaking down. Sherry, at your age, guess what? It's breaking down faster than it's building up.
When you say my age, I can safely say
You're
older than 30, less than
30.
50.
That's right. Over 30 is really the key. You start to lose a little bit of the bone density and the mass, all right? And drinking milk isn't necessarily enough. One of the things that you can do, or should be doing with your drinking of milk, is you should also be exercising. Resistance exercises against gravity with some weight is the key to slowing down the progression. Osteoporosis is going to happen to all of us. It happens in women earlier than men. Postmenopause accelerates the process for women, but by 70th decade, we're on the same page. Women accelerate earlier in the process, men catch up later. That puts us at risk of fractures. That's the key. We want to slow down that progression. You can slow down the progression of the process and that deterioration if you put more demand on the bone, and that's the resistance exercises.
Is there anybody that's more at risk to osteoporosis?
Well, there are some risk factors. Thin women, Asian descent, white descent are at greater risk. People who have poor diets, a lot of caffeine, smokers, all of those things have an impact on that acceleration process. The earlier you have your menstrual cycle start, then you actually start kicking into menstruation or menopause a little bit earlier, and then that accelerates that process.
A lot of what you're talking about, women.
Women early on. Men do catch up later. That's one of the things that people don't remember. But yes, women are at greater risk for sure earlier.
So you still should drink milk, but if you are over 30, less than 50, there are a lot of other things that you need to do.
Absolutely.
And so you don't need to drink any milk, right? Because you're way past that 50 thing.
Well, milk's good for you in a lot of other ways, but you're right. I have to start doing some resistive training and exercise. And I'll tell you why. Your risk of fracture is tremendous. And the fractures occur in some specific points in your body, which can change your life.
Okay.
Let me show you on a skeleton what happens.
All right, you want a drink?
I don't think.
All right. We've brought along Mr. Bones to help with your demonstration.
That's right. The reason for that is because when you have osteoporosis, the bones weaken. This is the structure that supports us. In osteoporosis, there are two really vulnerable places. One is the hip bone. That can be affected by osteoporosis, and a fracture occurs there. That's why you hear a lot of the elderly folks, as they age, they have a hip fracture, and that's what scares them. One of the reasons for that is osteoporosis. Again, we can slow that down. The other area that's the most vulnerable is actually in the spine here, and I have a portable one, and I actually drew a mark on it. The front of the spine is the most vulnerable, and what happens is, you've heard of compression fractures, this actually collapses in the front. Normally the spine has a curve like this. If you have too many compression fractures, it starts to bend the opposite direction because the front of these all collapse. That's what gives you that rounded, poor posture as you get older also, because of that osteoporosis. All of this is sometimes preventable, and you can do that by doing resistive training. You can't get rid of osteoporosis, but you can slow the progression down.
You're talking about the training. I know you and I had talked about this, about sit-ups, that's not necessarily a good idea.
A bad idea, absolutely. This is one place you don't want to do sit-ups, because if you think about it, when you bend and you put pressure on the front of that spine, a sit-up will actually make that weakened area collapse, and that is absolutely a no-no. No sit-ups when you have osteoporosis.
Okay, so it's very important that if you do have osteoporosis, you have to exercise, otherwise it's just going to get worse.
Correct, and the exercise has to be resistance, and the best thing to do is go see a physical therapist, have him customized for you, because you don't want to go to the gym and do sit-ups.
Okay.
Started having trouble with my knee about 3 years ago. I had a lot of pain. I wasn't able to walk up the steps or walk down the steps. Well, they took x-rays of it, and they told me that I needed a knee replacement. And I had actually a ½ inch of the bone was worn down. After the surgery, I stayed in the hospital for a week, and I had physical therapy there. Then I came home into Pittsburgh here. I have a home here in Pittsburgh too, and a nurse came to see me every other day, and physical therapy came every other day. Then after 1 week, that stopped. And then I was recommended to your physical therapist. Well, when I first went there, I went to see Rob the first day, and my leg was swelled so bad, within 30 seconds, he sent me to see Suzanne, which was in the next building. And then Suzanne took care of me. She wrapped my leg and she put ace bandages on it and sent me home, and I came back the next day. And when I came back the next day, the leg actually, the swelling went down 3 inches. And she said, that is absolutely unbelievable. So from that day on, Suzanne took care of me, and I'm still going there, and the treatment is just absolutely wonderful. And you would think that everybody on that staff is trying to win a popularity contest. That's how wonderful they all are. To me and everybody else, because I can review and see everything that's going on there, and they're great. I would recommend them to anybody. Now, I've been going for 3 months, and I've gotten better. Every month I get better and better. I can see the improvement myself. I can't believe that the pain is gone and I'm walking as good as I am.
We were just talking about osteoporosis and what a risk it is if people fall, because they can break bones. Is there something that people can do if they have osteoporosis or not, that they can prevent themselves from falling?
Absolutely. There are two issues. Osteoporosis, when you fall, has the risk of a fracture, but a fall risk is a different risk. We have the ability to do a test. So if you came into the office, Sherry, and said, you know what, I'm over 65, and I know you're not, but you're over 65, your risk is dramatically higher for a fall, and the consequences of that fall are dramatically higher. You can become disabled, your life changes, or that can lead to death. So you come into the office and see me and say, you know what, I'm going to put you through a simple test that can measure your risk of falling. And then you're going to fill out a little survey that we can assess some of those risks. It's a very simple test. It can dramatically change the consequences of a fall or avoid a fall, prevent a fall from happening. A fall occurs for many reasons. I'm wearing glasses. If my glasses aren't up to date, I don't have the ability to necessarily see things at night that may potentially cause a fall. So checking your vision is one of those things to do, and you can intervene. Your environment. If your environment is cluttered, you have tripping hazards such as throw rugs or just things in the way, that can cause a fall. Getting rid of the clutter, getting rid of the throw rugs, two interventions that are pretty classic. Okay, those are ways to prevent. At night, when we get up to go to the bathroom, bare feet is not a good idea. Bare feet has the tendency to create a fall. If you're not in good shoe wear outside, that can create a fall. So shoe wear inside and outside is important. Good, solid shoe wear is important. As we age, we tend to get arthritis. We all do. As you get arthritis, especially in our neck gives us feedback as to what's upright. When you look around any room, what gives us a sense of where we are is if the wallpaper is straight up and down, the ceiling is horizontal, the floor is horizontal, those things give us a sense of upright position. At night, when we get out of bed, we can't really see those feedback pieces as well, so our vision's already diminished. What then gives us feedback are our joints in our neck. They give us a sense of what upright is based on the position of our body. When you develop arthritis and as you age, you lose that feedback. And as you lose that feedback, you then have another sort of diminished feedback as to what's upright. So you're at greater risk if you have arthritis. The lights are low. You may be in a new place, such as a hotel or somewhere else. That becomes more difficult.
If you're 65 or older, how do you know if you should take this test? Because a lot of people don't want to think, oh, I'm at risk for anything. Everybody should take it, or if you have certain risk factors in your life, how do you determine if you should take this test?
Everybody should take it. Here's the reason. Number one is we all live in environments that are not perfect. Vision, as you age, diminishes, and we tend to put off getting the new glasses or doing something, exercising, changing the arrangements of our house. So pretty much everyone, and once they see this and they assess their risk, then they're much better off. Listen, if you're 65, you take the test and you have no risk factors, that's great. It's rare. It's simple, easy things. Another example of an intervention that you have to take is you lose strength as you age. We've talked about that in the past. Leg strength is a risk factor for falls. If your legs aren't strong enough, very simple exercises can increase the strength in your legs and reduce your risk of a fall. Because if you have good leg strength, you have good eyesight, or at least improved eyesight with your glasses, you're wearing good solid shoes, you make sure the environment's not cluttered, you get rid of those risk of throw rugs if you have them in. Almost every house has them because we're trying to get a look or something. But they're tripping hazards and they're falling hazards, and those falls can create disaster. So pretty much anyone over 65 should assess their risk, and it's not only your body's risk, but your environment's risk also.
You use the number 65. Should people, even if they're not 65, look at some of these preventative measures, like making sure those throw rugs are secure, getting rid of them, making sure they have good shoes or non-slip in their bathtub? I mean, is it something that everyone really should take a good look at?
Well, the answer to that question is, do you want a broken bone?
Absolutely.
Do you want your head split open? Do you want all of us are at risk of falls, there's no question. And there's simple things to prevent those. Your children are going to potentially fall. You could fall. Elderly are just at a greater risk. So you're right. We do tend to focus on people that where those physical conditions can have a play, but your environment is tremendous. And that affects all of us, absolutely. Okay. So everyone can be affected by subtle changes they can make and prevent. And then those that are at higher risk, it's just a little bit more critical for them to do something.
So it's an issue that everyone, everywhere should really take a hard look at. Make sure that there aren't any factors in their home that can make them fall. And if they're over 65, take this test.
Absolutely. You don't want to interrupt your work life, which this can have an effect on it. You don't want to interrupt your school life. You don't want to interrupt your activities, your recreation, because when you fall, the consequences can change your life.
All right, thanks, Dr. Steve.
Sure.
We'll be right back.
I thought my life was over, pretty much. I didn't think I'd ever be able to do what I did before.
Where do you go with a sprain, a twist, or a tear when your body needs repair? Call Allegheny Chesapeake Physical Therapy. For many problems, the best treatment isn't pills or surgery, it's physical therapy from Allegheny Chesapeake. Therapy is often the best choice for the fullest recovery. Physical therapy works. Research proves it. When your body needs repair, call Allegheny Chesapeake Physical Therapy, 1-800-NEW-SELF.
Well, I've had 2 hip injuries, a knee injury, a shoulder, and a neck injury. And I've been here to rehab at Allegheny and Chesapeake for all of them. And I found every time that I was here, it always was better. They knew my body better and what all I needed to do to get back to either skiing or dance. They knew exactly how much strength I needed and how much stress I was putting on my body. So they knew where my goals needed to be set in order to do my rehab completely. Every time they've brought me back to the pre-injury condition and sometimes even into better shape than what I was before. And it's helped to prevent a lot of extra injuries after the fact.
Dr. Steve, what happened to you with your ACL typically doesn't happen to a person of your age, right?
Correct. It doesn't happen to someone my age. I won't be insulted by that comment. Typically it's someone younger. And someone younger, I brought an example of someone who would be more typical. Sarah Molzan, welcome.
Hello.
Hi, Sarah. How are you?
Good, how are you?
If you don't mind, how old are you?
I'm 17 years old.
And you've gone through the ACL, correct?
Yes, I have.
How was the rehab, Sarah?
It was great. It was a long process, but it helped me get back to everything that I did before I had the surgery and before I hurt myself.
I take it you're very athletic?
Yes.
And is that kind of how the injury happened in the first place?
Yes, I tore my ACL doing gymnastics, doing a flip. So after that, I had the surgery, and then I just started recovering for about 6 months, and now I'm fully recovered.
So your recovery of 6 months was rehab?
Yes.
You did a lot of exercise and stuff like that. When
Yes.
you say you're recovered, are you recovered in doing all the flips and the other things you had talked about?
Yes.
You were doing before?
Yep, I'm even doing probably more than I did before, so I'm even stronger, which is
That's
good.
great.
Were you worried at any point in time before having the surgery, after having the surgery, that you weren't going to get back to where you were?
Oh yeah, I thought my life was over pretty much. I didn't think I'd ever be able to do what I did before, but Allegheny Chesapeake helped me out so much. Without them, I wouldn't be able to dance or do anything that I could do before.
And your main sport at this point is dancing with aerobics in it, is that correct?
Yes, acrobatics.
Acrobatics,
Yeah.
acrobatic dancing.
Yeah.
And do you notice, I mean, I know you do a lot of flips and different dance moves where you're going to use your knee and go to the ground. Do you notice at all that it still hurts, or do you favor it at all?
Not really. I'm pretty much, it's just like my other knee, just normal.
That's my goal.
That is amazing. See, that's why it happens to the younger people, so they can recover a little bit quicker, right, Dr. Steve?
You'll be fine.
All right, Sarah,
Thank
thank
you.
you.
Thank you.
Thanks, Sarah.
We just finished talking with Sarah, and she had ACL surgery
Yes.
for a sports-related accident, and I'm hearing that you kind of know an ACL injury pretty up close and personal.
I do. I had the same injury.
I'm thinking maybe I should ask you how you got that injury.
Well, if you remember back, there was this little tennis match that
I remember
made me
the one
run
that I
side
beat
to
you.
side. Yes, well,
Yep.
that was the injury.
So, what happened?
I tore my ACL and I had to have it reconstructed surgically.
Did you know at the time that you had torn your ACL, or?
I did not, actually, and I had a suspicion, and then I confirmed that suspicion, and then had surgery.
And the surgery consisted of?
Well, maybe the best way to explain that is to talk to my surgeon.
All right, sounds good.
Okay.
Joining us now is Dr. Rytel, an orthopedic surgeon. Doctor, thank you so much for joining us.
You're
We've
welcome.
been talking a lot about ACL injuries. We spoke with a young girl who underwent ACL surgery from a sports-related injury, and also Dr. Steve from what we call a stupidity-related injury.
Now.
We're just trying to bring it down a little bit and find out exactly what the ACL is and how you injure it.
Well, the ACL is one of the main ligaments in the knee. It's deep inside the center of the knee and helps keep the knee stable when you're doing things like sports. The common way of injuring it is a combination of weight bearing and twisting on the knee, and then the ligament essentially snaps like a gum band.
When you break your leg, they just go in and kind of put it back together and it heals itself. Is that the case when you tear your ACL?
No, it doesn't work that way with an ACL. The problem with the ACL is that where it's situated in the knee, once it tears, it's no longer in contact with the place where it belongs. Also with ligament injuries, once the tear occurs, there's more damage to the ligament. So it's not something that you can sew back together and have heal.
Okay, but I know
That would have been an easier surgery for me had it just been able to be sewn back together. So.
in his case, how did you repair it? I know we have some video of his actual surgery, if you don't mind. We're going to show that. How did you repair his tear?
Well, for Steve, what we did is took a piece of his hamstring tendon from the back of his leg, and we made a new ACL out of that.
Wow. Technology and ways you heal things anymore have come a long way in recent years.
They really have.
He's done a great job too, because I can tell you, I'm probably ahead of schedule as a result of the surgery, and he did a great job.
Recovery time, not long for him. I mean, is that typical for a normal person?
Well, Steve's definitely a little bit ahead of schedule. Most people from an ACL surgery, they go home the same day. On average, they'll spend about 3 weeks on crutches. It takes about 2 to 3 months to get to a point where you can jog. And for more vigorous things like sports that require cutting or jumping or twisting, it's about 6 months.
And you're back to normal, correct?
Pretty close.
With some physical
pretty
therapy
close.
along the way, correct?
Yes, lots of physical therapy.
All right. Well,
So in 6 months, I can challenge her to tennis again?
you
you
still
can.
won't beat me. That's what we call stupidity injury.
Yes,
Why would you
I hear
challenge
you. I hear
me
you.
to tennis?
I hear you.
Swimming. Someday swimming.
Oh, that would be stupidity too on my part. You were a swimmer.
Doctor, thank you so much. We really appreciate your help today.
You're welcome.
Thank you.
Where do you go when arthritis aches? When there's pain in the joint? When your body needs repair? Call Allegheny Chesapeake Physical Therapy. For many arthritis problems, the best treatment isn't pills or surgery. It's physical therapy from Allegheny Chesapeake. Physical therapy works. Research proves it. For arthritis, when your body needs repair, call Allegheny Chesapeake Physical Therapy. 1-800-NEW-SELF.
I was working out in the gym. I've been on a weight loss program at the parish Big Loser program. They've pledged so much a pound for me to lose weight. And I've lost, 39 pounds officially. But I was on my regular workouts at the gym, and for some reason, I began to get a swelling in my neck, Lori tells me, and I couldn't raise my head, and that set up a secondary swelling where I couldn't reach out with this hand, which plays havoc when you're trying to work the computer or when you're trying to golf. And so I came running right to here because the physical therapist, Lori, and Molly, her assistant, just get me in shape every time I get in trouble. With about 6 weeks of therapy this time, they got me back to normal again. Every time I get in trouble, whether on the golf course or in the gym, I come running back to Lori and Molly, and Allegheny and Chesapeake puts me whole again.
There's no place like home. There's no place like home.
Walnut Medical is the area's #1 home medical equipment provider, devoted to getting you home as soon as possible. Walnut Medical has 7 convenient locations and services 18 counties in central and western Pennsylvania. Walnut Medical specializes in hospital equipment and medical supplies. Walnut Medical has 2 convenient Johnstown locations, Main Street downtown and Franklin Street next to Martellus. Remember Walnut Medical, because there's no place like home.
All right, we're back from Shady Side where we saw a little slicing and dicing of Dr. Steve's knee. There was good stuff out there.
That's right. I do anything for the show and the education. I sacrifice a lot. ACLs can be reconstructed. You can get back to being as good as new.
We also talked about osteoporosis and how everyone from the young to the old can prevent it.
That's right. And at your age, you got to do more than drinking milk. So you got to do the exercise. It's got to be resistive strengthening to get it done.
We talked also about falls and what you can do to prevent them at home and away.
That's right. And even you, at your age, could benefit from this. You can avoid those falls.
You know what? You're talking about all of this. I'm thinking I'm going to take the Gimp for a run. What do you say we head out for a run?
All right, it's a deal. You go that way. Ready? I'm right behind you.
Do you have a question for Dr. Steve? Submit your questions online at thedrsteveshow.com or call 1-800-NEW-SOUTH. That's 1-800-639-7353.